For an end range supination liftoff for your elbow, we are gonna need a yoga block or a towel to roll up and block your shoulder from helping and compensating, and then some sort of stick that does not bend very well, like a broomstick, a PVC pipe, or a dowel rod. Now, the movement supination is this movement of bringing your forearm, bottom side of your forearm or palm up towards the ceiling. So we're gonna start in the position that you can. Now, if you don't have a lot of supination, that might be starting here. It just depends. I'll kind of show you the spectrum of how to set this up for your body, because the goal in an end range liftoff is to find your full passive range of motion and then back out of it as little as possible, but as much as needed. And then from there, do the movement where you are trying to lift off. And it is a micro movement. It is really short. It is a lot of mental concentration to not compensate, but that's how we start to take some of your passive range of motion and capture it as active range of motion and building strength in those positions, which is really important for overall performance and injury mitigation and prevention. So what we're gonna do is start with forearm up towards the ceiling, bottom of forearm up towards the ceiling, elbow bent at 90 degrees and elbow glued to your side with your yoga block or towel. Now, what we are going to do is first see our passive range of motion, which is all the way over here for me. So you want to grip this nice and strong so we are not just using our wrist and we aren't losing the position here. So we want to make sure we are locked in everywhere except right here, rotating our wrist and forearm. Once you get to your end range of motion, you're gonna back out a little bit and see if you can do a liftoff. A liftoff is going to be this motion. So you see how all I'm doing is trying to rotate my forearm to the side that my shoulder is. So I'm on my left side, I'm trying to rotate towards the left, I'm trying to lift this off. Now, I have this much range of motion, but only this much control. I have to go all the way back here to my mid-range to find my strength. That is how much of a deficit I have. You need to find the position that is as close to your end range as possible, but you're able to do a liftoff with like max effort. This is a really hard exercise. So if you back all the way off here and you try to do it, look how much range of motion I have, right? That is too easy. It is too far back. So harder is gonna be up here or in your end range of motion here. Easier is gonna be more towards the middle or even down, because you can see what I'm doing as I'm doing that is going from my end range of motion here to more of my mid-range here, or more of the start position. So starting is gonna be like thumb up to the ceiling or even thumb towards the opposite side or bottom of your forearm facing down, all the way up to progressing to the end range here. So find your position. The first couple of times gonna take practice and then do your lift off there. Find those tissues. You're gonna find the outside elbow, contract them, ramp them up, and then float the broomstick or pipe or whatever off your hand. Hold for the prescribed amount of time, 3 to 5 seconds, and then parachute it down. That control is really important. It's one thing to just do things really fast. You'll notice I'm compensating all over the place and we're not getting the most out of the exercise, and you're most likely not going to get the full benefits from it. So we want to really control the up and really control the down. So you want to hold for the prescribed amount of time, do the reps and sets that you're prescribed for, and then over time, we want to try to progress the position to get more and more of our range of motion that is passive and turn it into active, usable mobility that you can do in your daily life. That's how we improve overall performance and reduce injuries and have happier, healthier elbows. So over time, you should feel like you can progress the position, but it's gonna be very slow progress over time because that's how mobility works. When you're doing this, again, you should feel outside elbow stuff contracting, inside elbow stuff might be stretching a little bit, but ultimately you shouldn't feel any pinching on that outside elbow at all. You shouldn't feel any pain during these either unless instructed by your physical therapist or clinical provider. So please don't push it into pain. Remember to progress over time, and you should see that your elbow is slowly getting a little bit stronger and a little bit more mobility.